illness that usually strikes in late adolescence or early adulthood, but can strike at any time in your life. The signs and symptoms vary from individual to individual, but all people with the disorder show symptoms such as delusion, hallucination, bizarre behavior, disorganized speech, and other negative symptoms. Delusion are brief feelings that are not true. These feelings are feelings that you might feel like someone's following you, setting you up, or trying to hurt you. Some of these feelings might also include that you have supernatural powers or abilities that are better than everyone else. Hallucination includes hearing, smelling, tasting, and feeling things that are not there and just part of your imagination. Bizarre behaviors. A schizophrenic person may behave in ways that are inappropriate, uncomfortable, or bizarre towards a normally stable mental person. Another symptom that a schizophrenic person may suffer from is disorganized speech. In disorganized speech, sentences don't flow well, the individual does not have chronological order of his speech, and conversation may change in between sentences. Last but not least symptom, it's negative symptoms, which is when a schizophrenic person decreases his or her interest in personal hygiene, social life, and has lack of motivation and emotions. It is hard to determine whether or not schizophrenia is genetic or not. However, you have a higher risk of 6.5 in developing the disease if you have a first relative with the disease. Environmental factors that help in developing schizophrenia are drug abuse, the living environment a person lives in, and prenatal stressors. Living in an urban city decreases the chances of developing the illness depending by the urban city drug use and social groups you surround yourself with. Another factor that might increase a person's chance is social isolation. The more time a person spends alone, the more he starts talking to himself and hearing things that are not there. Other factors include unemployment, racial discrimination, poor housing condition, bullying, and family dysfunctions. Epidemiology. Schizophrenia affects 0.3 to 0.7% of people's lives at some point. 24 million people have been affected by the disease at some point in their lives in 2011. It appears earlier and it is more common in men rather than it is in females. Symptoms usually start appearing around 20 to 28 years in males and 26 to 32-year-olds in females. The most effective medication for schizophrenic is antipsychotic medication. This medication can reduce symptoms in 7 to 14 days. Psychosis medication can be significantly expensive, which psychotic to use will vary depending on risk, costs, and benefits. Family therapies and cognitive behavior therapy may also be useful in the treatment of schizophrenia. The reason I have decided to do this video is because my aunt has been diagnosed with schizophrenia when she was about 23 years old. The disease has been really stressful in our family because none of my family members had before encountered any of our other family members with a mental illness, so it was the first time for my family members to deal with this. My aunt had gotten better actually with the disease with the help of family therapy and just my family, my aunts, my mother, my grandmother, my mother being really supportive of her taking her medications and just watching what they say around her, what they talk about around her. But my aunt is actually getting better and she actually does take less medications right now because of family therapies that have actually helped her improve the symptoms that she was feeling, and with the medication she would just kind of be tired and go to sleep afterwards. But with the family therapy and everything else, with the support of my family members, she's been getting better and she's been taking less medications because she's kind of have not been feeling those symptoms again. I think schizophrenia is a very scary disease that can happen to anybody at any time, and it has no way to prevent it. It just happens, and it is kind of something that interests me because my aunt has been diagnosed with it, but I'm also interested in it because it just naturally comes to somebody. It cannot be stopped, it cannot be predicted. And this scary, but it is one of the illnesses that people have to wake up and face with it every day. And I think it's very sad, and I think it should be taken more in consideration and be studied